In Surrey, there are currently an estimated 14,300 young carers, children and young people under 18 who give practical, physical or emotional care and support to a parent, sibling or another family member with a disability, long-term illness, mental health issues or a substance abuse problem. Being a young carer can often have a severe, significant and long-lasting impact on a young person's health and well-being. Tiredness, poor diet, interrupted sleep, back injuries, stress and trauma are just some of the physical and mental health issues that come with being a young carer. If left untreated, these can continue into adulthood. In our 2013 Young Carers Health Survey, 35% said that their health has worsened due to their caring role. Another 35% recognised that they experienced the symptoms of an eating disorder, with 9.6% relating this specifically to their caring role.
They cancel appointments and letters are sent with the wrong people's names on. They are always late, but when they have been there, I have found them really useful.
Being a young carer can be stressful or annoying, even subconsciously, or it might lead to bullying or problems at school, all of which make you feel horrible and wanting a way to cope. Stress can make people do some dangerous things, such as self-harming, skipping school, or not eating. It might even lead to depression.
My GP surgery doesn't understand that I've been affected by caring for my sister, so they don't understand where I am coming from and don't believe what I'm telling them.
I need the pharmacy to understand that my prescriptions are urgent. When I make a repeat prescription, I would like it to be ready in the time they stated, so I don't have to wait half an hour for my prescriptions or to keep having to get an emergency prescriptions.
The survey also showed that young carers are not looking after themselves, and many will not be aware of the impact that caring has and will have on their future health.
Young carers need to be identified by their GPs so this can be noted on their medical records. Knowing their patient is a young carer, GPs can then monitor and check if they need extra help and support. This can be in the form of counselling or a carer's break. Prescribing us antidepressants isn't always the answer. Appropriate referrals can then be made to other agencies and professionals to reduce inappropriate levels of care. Making appointments can be difficult for young carers. Surgeries need to be more flexible with their times and GPs available on the phone. Sometimes all we need is reassurance.
One of the major stresses that we face as young carers is that while we spend most of our times looking after someone, we're sometimes the last to know about things. This can be to do with their medication, hospital appointments, or social service visits. Be open about what's going on with the person I care for. Please don't keep useful information private. If you don't tell us things, we just worry or look it up on the internet, which isn't always the best thing to do.
But most of all, talk to me. Really listen and don't make assumptions about what I do and don't know.
My mum has epilepsy. She is changing her medication and might be able to come off her tablets altogether. I worry about her a lot when I'm at school because I'm not with her. What happens if she has a fit? I would like to know how to help her if she has a fit whilst I'm there. Lucy from Surrey Young Carers has asked someone from the Red Cross to come and talk to me and to show me what to do. This will help, as it will make me worry less and I'll know what to do if Mum does have a fit.
My mum has made a Velcro board with different words and symbols on it for him. He can point to things and we know what he wants. This has really helped. He can now say my name and my sister's. He tries to say sentences. No one told my mum how to do this, she just did it herself. He is 10 now and he started this 2 years ago when he was 8. If someone had told my mum to do this sooner, he would be able to say even more words. Why didn't anyone?
The reason why he behaves like he does, he finds it hard to share.
When I was 11, I started managing Mum's medicine. No one spoke to me or told me about Mum's condition. No one explained to me the behaviour. The pharmacist didn't speak to me when I picked up the prescription. Doctors didn't tell you what was going on. They didn't register me as a young carer and didn't explain what services would be available to me.
I would like more people to know about motor neuron disease because it is a rare disease and not many people know about it. I also think that it would help families who deal with it because they would know that more people would know about it. It can also raise awareness of what families do for the people they care for.
Healthcare professionals, acute trusts and community providers can also play a significant role. Again, talk to us. We don't bite. And by identifying us as young carers, we can be signposted to appropriate services who can also provide age-appropriate information and training. Hospital staff also need to know if we're young carers, this should be recorded on medical notes. Remember, we need to know if you change their medication and when they will be coming home. If you're coming to visit at the house and you know there is not a young carer there, please make the appointment when we could be there as well. We'd like to know what is going on and may be able to answer some questions for you. It would be nice if we had the same staff working with us and our family. This way we can build up a relationship with you and we're more likely to be honest and tell you things. Building this rapport and trust is very important to us and our families.
When having appointments with my sister, please treat me as a carer, not as though I won't understand. It is important that I understand my sister's medical needs.
Professionals also thought I was lying and always believed my mum over me. It took 17 years for one person to believe me.
Being a young carer can negatively impact on our education and learning. Around 1 in 20 miss school because of their caring responsibilities, affecting not just our education but our chances of longer-term employment. We also have significantly lower GCSE results, 9 grades lower overall than our peers. That's the differences between 9Bs and 9Cs. Our reading and writing skills can be affected. We don't always have the courage to tell the teachers, and then things just get worse. It would be good to know there is at least one teacher at school that knows about young carers and who we can go to for help. We sometimes don't tell our teachers that we're young carers as we don't want to be treated differently. If we do tell you, please don't tell everyone or tell other students. If we want to tell our friends, then we will. School groups are a good way for us to meet other people in the same situation. Only other young carers know that what you're going through. It's good to talk. Having access to our mobile phones at breaks also will be good. We worry about the person we care for if they are alone. Have they fallen? Will they remember to take their medicine? Just a quick call and text can reassure us. Sometimes it does all get too much for us. We can get angry and our behavior can be not too good. Take the time to ask us if everything is okay. Sometimes we just need the opportunity to tell someone.
Young carers are also more likely than the national average not to be in education or employment training between the ages of 16 and 19, which reduces our future life chances. A quarter of young carers are bullied at school because of their caring role. Only half receive additional support from school staff. We need to know that there is someone who we can talk to and who will listen and take us seriously. Telling us to ignore the bully isn't very helpful. Schools are vital and ideally positioned to play a collaborative role in identifying young carers and initiating support for young carers and their family. The education advisors at Surrey Young Carers will happily come into the school to raise awareness amongst staff and pupils and do staff training.
I'm in Year 8 now and finding things quite hard. English especially. I can't read the books. I take them home and practice, but I don't seem to be getting any better. I don't think my teacher will listen. She doesn't believe I have a problem. She thinks I'm making it up.
I got help for my dyslexia in my last school, but not in this one. The teachers don't know as I haven't told them. I don't think they will listen. Schools need teachers who know about dyslexia and can help me and others who have dyslexia.
Because my mum lost her job, I'm finding things are getting more and more unaffordable, especially at school because I do GCSE catering and we cook every week, and I find it can get very expensive.
I go to the same school as my brother. Sometimes he has meltdowns and I'd like to be able to help calm him down, but I know that he has them quite often, so I'd always be in his classroom. I worry about him though.
It would be nice for adults to actually talk to us and ask us what we want. I'd really like a young carers group at school. There is somewhere you can go, but I don't attend. I'd start going if there was one just for young carers who could talk about relative stuff.
I remember in year 7 and 8 when a girl in my school had Asperger's and I became so isolated from the rest of my year group as everyone bullied her and I was the only one who stuck up for her and who would treat her normally. Now she has moved to a boarding school. Teachers never fully explained her condition and students still view her as a retard when she was brighter than most of our year group. but even to this day I hear spastic and retard being used as a way of calling someone else stupid. Everyone is so oblivious to what they are saying that they don't even understand what the words that they are using mean.
I would like to go to my brother's school so that I can see how he behaves, and also I could talk to his teachers and ask them why he behaves in a certain way. An open day at my brother's school for families will help with understanding.
Young carers also may have difficulty socialising with their friends, having a hobby, joining with sports and leisure facilities and after-school activities. This is due to a lack of time, due to our caring responsibilities and sometimes parental support. Being able to access some things is also hard due to the cost of getting there. Public transport is expensive and so is entry to leisure centres.
Being stressed is a major thing for young carers, and being able to access sports and leisure facilities would be a huge help. So while our friends are out and about, we're at home. This means that we don't have many friends. Many of us don't tell people at school about what we do at home. Sometimes we just don't want to. It's nice to keep home and school separate. But sometimes it's because we're embarrassed or ashamed. This is especially true if the person we care for has mental health problems or a drug-alcohol issue. Having friends home isn't easy either, especially if you have an autistic brother or sister who screams or doesn't like strangers in the house. All of these things can also contribute to the bullying that many of us experience.
I never get to go out because I have to help her out a lot. I never go out with my mum. I feel left out because all my friends say how they're always going out with their families. My older sister has severe autism and epilepsy. I have to stay with my sister as much as I can, so I can't get out as often as I would like to.
I love music and playing instruments, and I love learning new things. But because I help to care for my brother, I don't have the time to do things that I like. I don't mind too much.
Just time by myself. Just chilling. Isn't that what everyone wants?
My brother has autism. He scratches and hurts me. I have scars on my arms and legs. He has been excluded from school and so is at home all day with my mum. I worry about her and what he'll do to her without me and my sisters to help. He is going to a special school soon, but I don't know when. We want him to go so that we can do normal things again. I'd like to have my friends around and go out with Mum without him.
I wish I had time alone with my family while somebody looked after my sister, because I have to spend all my time with my sister and no time with my mum. Also, my sister doesn't like loud noises or the dark, so I hardly get to go to the cinema, theme parks or shopping. My sister always spends time with my mum, although I hardly spend any time with her at all.
I would love a day out with my brother. He has action to channel. He's in a wheelchair. We can't go to fun places. I just want a nice place that's accessible for wheelchairs.
She spends a lot of time with my sister, and I get blamed for things that my sister does. I've tried to tell her how I feel, but she doesn't listen.
I like going on the back of my mum's wheelchair. It has a motor and hand mode. This makes it easier for me to push it. She has about 4 wheelchairs for different things. It means that we can go out together. I like going to Chesington.
Spending time with our mum and dad can also be difficult. Lots of their time is spent looking after our brothers and sisters or grandparents or husbands and wife. This doesn't leave much time for us. This can make us feel resentful and jealous, and we can then feel guilty about feeling like that. It's so important to have fun, both as a family and on our own with our parents, but we find this difficult. It's not always easy to access venues, public transport costs are high, and people can stare. All of this makes it hard. Having respite care would mean that we can have our time with our parents, as they don't have to worry about the person we all care for. Also, having the right type of mobility equipment, so they are able to come out to do things with us.